virus is a large family virus that causes disease in humans and animals. In humans, it usually causes respiratory infection, from the common cold to serious illness such as Middle East Respiratory Syndrome or MERS and severe acute respiratory syndrome or SARS. A new type of coronavirus that was discovered in human science. The outbreak occurred in Wuhan, China.
How to spread the coronavirus according to WHO. 1. The spread of the coronavirus through droplet. 2. Spread of the coronavirus through the air. 3. The spread of the coronavirus through contaminated surface. 4. The spread of the coronavirus through fecal, oral, or human waste. A study show the coronavirus particles are also found in the fecal modes of infected people, such as urine and feces.
The following is the procedure for preventing the coronavirus according to WHO. 1. Wash hands frequently. 2. Keep your distance. 3. Avoid touching eyes, nose, and mouth. 4. Perform respiratory hygiene. 5. Seek medical care. And 6. Update information and follow advice from medical personnel.
There are 12 tips that we can do every day to increase immunity during COVID-19 pandemic. 1. Enough rest. 2. Exercise regularly. 3. Balance nutritious food. 4. Eat foods that support the immune system. 5. Consume lots of water.
One of the reasons for the coronavirus to continue to increase in Indonesia is that most people are not disciplined in keeping their distance and wearing masks. In fact, besides being diligent in wearing masks and washing hands, maintaining distance is one of the key to narrowing the space for the spread of the coronavirus.
Our President, Mr. Joko Widodo, has issued several regulations related to COVID-19 to reduce the number of positive cases. As first, Presidential Decree Number 7 of 2020 concerning a task force to accelerate the handling of COVID-19. Second, Government Regulation Number 21 of 2020 concerning large-scale social restriction in the context of accelerating the handling of COVID-19. Third, Presidential Decree Number 11 of 2020 concerning the determination of the public health emergency status, and the other regulations that have been issued by the government.
What should we do in pandemic COVID-19? Protect yourself and others around you by knowing the fact and taking appropriate precautions. To prevent the spread of COVID-19, 1. Clean your hands often. Use soap and water on an alcohol-based hand rub. 2. Maintain a safe distance for anyone who is coughing or sneezing. 3. Avoid crowds and practice social distancing. 4. Wear a mask. 5. Don't touch your eyes, nose, or mouth.
In general, there are 3 general symptoms that can indicate a person is infected with COVID-19, namely fever, body temperature above 38 degrees Celsius, dry cough, hard to breathe. In addition to the symptoms above, there are several other symptoms that are rare but can also appear in COVID-19 infection, namely tiring easily, muscle ache, loss of smell, or anosmia. Symptoms of COVID-19 can appear within 2 days to 2 weeks after a person is infected with the virus that causes it. Some COVID-19 patients also experience decreased oxygen without any symptom.
Diagnosis of COVID-19. To determine whether a patient is infected with COVID-19, the doctor will ask about the symptoms that serve the patient. After that, the doctor will perform the following examination: rapid test, PCR test, or swab test, CT scan, and complete blood count. Please note the rapid test on COVID-19 is only used as a screening test, not to confirm a diagnosis of COVID-19.
Treatment of COVID-19. Until now, there is no cure for COVID-19, but now the government has given vaccine to its people. If you are diagnosed with COVID-19 but have no symptoms, you can do self-care at home, namely self-isolation for 2 weeks, take temperature 2 times a day, morning and evening, wash hands with soap or hand sanitizer, drink a lot of water, get enough rest to speed up the healing process.